So we want to know, here at Vision Veterinary Hospital, who are your most common patients? Whom do you usually treat? Whom do you usually receive?
Thank you. Our most frequent patients are dogs and cats.
Dogs and cats?
Yes.
Walk us through, or at least like the top most common diseases that usually pets suffer and how we can prevent them.
Yeah, I would say the most common diseases are classified into two parts. One is infectious diseases and others are non-infectious diseases. So it will be a hard question, but I will try to make some of them. The most common infectious diseases are the diseases which we normally actually isolate. So the first one I'll try to say in dogs and cats. In dogs, the most common ones are canine parvovirus, canine distemper, there is also canine hepatitis, there is also what we call kennel cough, and there is also another one which is called leptospirosis, and the last one which is potentially known as rabies. Human also can get rabies. So there is also tick-borne diseases. They are also infectious. And going to cats, the most common cat diseases is we have feline herpes virus. This is one of possible the potentially common disease in the cats. There is also a feline panleukopenia, and also there is feline calcivirus. So they are very common in cats, and they are also infections. So I have the other list of the infections, and that one is very big. I would say I can classify it in simple words as it's. I would say every system of the animal has specific diseases. So from I would say ear infection, they are common. We have ear infection, have skin infection diseases. There are many. We also have I would say eye disorders. They are common.
How do you know though? Like, let's go back a little bit. Like for rabies, how do you know that my cat or my dog is suffering from rabies or has rabies? How do you know?
That would be a good question, but there are common signs that anyone can know. The most common signs for rabies, actually, that's a good question for people to know, is that it has stages, but it will start from the dog will start to isolate and isolate himself. The dog will start to have what we call picker, going and pick things, eat many things. Aggression will go high, the dog will get aggressive, and there is the common and the typical sign that you'll see is the drooling. The dog will be drooling and a lot of saliva coming. The same symptoms keeps going on, and the dog will start maybe to bite everything around and also to have eyes coming out. And another sign which is nice is the dog will be afraid of light and water.
That's supposed to be nice though.
I mean, it's easy to see.
Okay.
That's what I mean. Because I mean, for people who don't know rabies, it's not easy to know it.
Yes.
So if I'm saying nice, it's because I am a medic, so it's easy to see. They will be hiding from light and water. And the other sign, it goes severe and severe. They can have coma, which actually is the last stage, and then dies. So the dog will die in 10 days. So if you suspect actually rabies, the best thing you do is to call the vet and also to contain the dog. Do not let the dog go anywhere.
So that means it is very, very dangerous.
It's very dangerous. The dog will die in any case.
In a span of 10 days?
Yep.
That is so bad.
So that's also what we do to confirm what is it. Despite the laboratory examination that they do afterwards, that's an easy way that we can do to know if it was rabies.
Thank you. So this is non-infectious.
Infectious.
It is infectious.
Yes. Can be transmitted to humans. It's one of the potential reasons of tick disease. that have been reported by the World Organization for Animal Health.
So aside from the fact that it is a very, very dangerous disease, which is infectious and can also infect humans,
Yes.
that means that the owners of pets should also be careful.
Should be careful. That's why we actually recommend vaccination.
Oh.
Yeah, recommend vaccination, because if you vaccinate, you protect the dog and also protect the health of your family or surrounding neighbors.
So when is someone supposed to bring in their pet for that particular shot, for that particular vaccination?
The puppy should be vaccinated at 3 months.
3 months.
Yes. And the owner should be coming every year for a booster.
Oh,
Yeah, so
for the rest of the pet's life?
yes.
Every single year?
Yeah. So this depends, but in our country it is like this, especially in the location of the East Africa, Sub-Saharan Africa, because we are now counted as the endemic region for rabies. That means there is possible cases which are coming of rabies. But for the countries like Europe, like America, where they have eradicated rabies, they do repeat it every 3 years.
Oh, that's
So,
really good.
so it depends. Yeah, we have also different non-contagious, non-infectious disease, and they are also quite often. Then can be for cats and dogs, all of them. For instance, I was starting from skin infection, eyes, ear infection. Also have like traumas, and there are actually several diseases in that part of the diseases. Like in cats and in dogs, we have the problem with them, like pushing. So there is also tumors, cancers, I would say. Dogs also do have a lot of cancer, a lot of tumors, and I would say lastly, the list is long.
The list is long.
But
At least we have like an ideal type of the most common diseases and how we can prevent them.
Yeah.
So be careful, protect yourself, but also most importantly, protect your pet.
Yeah.
New Vision Veterinary Hospital, we're here to advise you, to guide you, and to also take care of your companion. Visit us.